This is a very interesting CT scan of the brain. Now, what we can see in this very nice CT scan is you can see there is dense black or jet black, multiple densities or multiple lesions are seen or inside the brain. Now, you can see this is black and this is also black. So, this black and this black is almost same black. This black is all of air. This is all air, and this is also air, because on the CT scan the most black structure is always an air, because soft tissue will always have some kind of whiteness or radio density. So the subcortical structures, they are also have blackish tinge, but this black is much lesser compared to this. So what you are saying, this dense black, this much of dense black uh, structure or this much of dense black attenuation is always only of air. So what we can see is there is extensive presence of air in the brain parenchyma. This is all brain parenchyma, and what you can see, this extensive dense black is all air. So this air should not be present actually in the brain. So and this was a case of actually road traffic accident, and you can very nicely see this is the left side and this is the right side. You can clear cut see that there is fracture of the frontal bone as well as the orbital walls as well as this is orbit, this is left orbit, this is right orbit, and you can very crystal clearly see that there is fracture of this frontal bone. See, this is intact, whereas this is all broken. There are multiple cuts, multiple fracture lines which can be very clearly seen here, as well as this is the fracture. So there are multiple fractures. So this patient had a road traffic accident with fracture of this frontal bone, fracture of the lateral wall of the orbit, middle wall of orbit, that caused entry of air from this part to directly into the brain. So the air has come inside extensively, and you can see this air in almost all the brain parenchyma. So this is air. So air in the brain, what we call it as pneumocephalus. Now we must know pneumocephalus, air in the brain is extremely irritating for the brain. So it irritates the brain and it will markedly increase the risk of seizures, convulsions, as well as it will make sure that the brain doesn't function properly. So patient may be in altered mental status, or patient may not obey for 3 to 4 to 5 days. The treatment for this pneumocephalus is very simple. Most of the time, we simply give high flow oxygen. So we simply keep the patient on high flow oxygen, and this all pneumocephalus is absorbed, which is what happened in next 24 hours. So this was the after accident, and this was after 24 hours. So after 24 hours we can see almost all the air is gone. You can see the air is very minimally present, almost 90% of the air was completely vanished. But in this CT scan, what we can see, there are some other findings which are very clear. For example, you can see whenever there is road traffic accident, we always get the contusional bleeding or traumatic bleeding. We know that this patient had right-sided injury, and when we zoom in, we can see in here this dense white structure is blood. This is contusional bleeding. Here also you can see the dense white structure or density is blood. So these are all bleeding because of the contusional injury. So these are contusional bleed which appear very hyperdense. These are the contusional bleeds, and around this contusional bleed, what we can see, a subtle hypodensity. So this is dense white, and around that there is a dense black structure. This is dense white, and around that what we can see is the hypodensity or blackishness. This is all perilesional edema. This is a perilesional edema, which is very typically seen with any trauma, any concussion injury or contusional injury. Apart from this, what we can very nicely make out, you can simply try to see it here, that the brain sulci and gyra should be much more clearly visible. For example, if you see here, you can see this is the sulcus. This is the sulcus. These are the sulci. So these are actually sulci which should be very well apparent. Here also you can see in here this is sulci. In here this is the sulci. So this sulci need to be very apparent and prominent. But in here the sulci is not very well. What we can see dense white structure. Here also you can see the dense white structure in the sulci region, and any dense white structure in the sulci or in the gyri portion suggests bleed, because this dense white structure should not be there. On CT scan brain, dense white or radio density structure is either blood or calcium or bone. So there is no reason why there should be a new onset calcium within 24 hours or new onset of bone within 24 hours. So if we are seeing the hyperdense sulci, that too especially after RTA, then it clearly suggests subarachnoid hemorrhage, because in this sulci gyri only we have the subarachnoid space. So if there is blood here, it means that is road traffic accident or trauma related bleeding in the subarachnoid space. That is the reason why there is subarachnoid hemorrhage, which can be very well seen in this portion and this portion. So this was a very interesting case of road traffic accident with extensive pneumocephalus, with contusional bleed, with perilesional edema around the contusional bleed, with subarachnoid hemorrhage. Thank you.